In these days, when everything is changing, children, especially at the primary level, are subjected to lot of emotional disturbances. In the TV, in the mobile, or even in the roads, they find a lot of problems connected with emotions. Sometimes they get angry, sometimes they cry, sometimes they do not know what to do. So therefore, a kind of an emotional instability is appearing for younger children, and this makes necessary for the primary classes to become the place where foundation is laid for emotional success. The most important thing today would be the teacher must play a role as a counselor. Teachers in primary settings are often the first point of emotional support. As you know, even in nursery classes, teachers act and help very young children like friends, like mother sometimes, giving them support. So all these things we see right from the nursery classes. So when they come to primary, that kind of a care is not seen. But I personally feel now we have to start building up the emotional support for children right from the primary classes. The teachers must involve blending academic instruction with compassionate guidance. Aim to create a classroom where every child feels they are taken care and they are heard. Understanding the dual role. That means primary teachers not only teach curriculum but also take care of emotion. That is the dual role they have to play. Young children rely on their teachers to model healthy social interactions. You have seen in many schools teachers getting angry, teachers beating them, teachers scolding them, teachers sending them out of the classroom. All these things are seen today. So the teachers must be trained to be with children as friends and create healthy social interactions. By acting as a first responder to bridge the gap between home and the school. When I say first responder, means like the nursery classes, teachers must be able to take the role of the parents and then help the children to come out of their emotional problems. The goal is to foster a sense of security that makes learning possible. If there is no safety, if there is no fear, children can learn much better than what they are doing today. Counseling is nothing but guiding children. I do not go deep into the meaning or the definition of counseling, but at the primary level, if the teachers take important steps to be active listeners, give students your full attention to validate their feelings. They may cry sometimes, they do not know what they are doing, they may look at either and either out of attention. These things are possible. Therefore, teachers must be active participation in the child's activity, especially when they talk to you. Empathy. Seek to understand the child's perspective without passing judgment. That means if the child does not understand anything, when you ask a question or to show, don't judge the child is weak and non-intelligent or idiot. Try to give them some support so that don't pass a judgment. Your judgment carries a long way. Patience. Allow children the time they see need to express complex emotions. There are many complex emotions. A child might have been beaten in the home because he wanted food or he did not do the homework. While coming on the road, somebody must have hit him on the road. So emotions are very complex. A child might have seen those things. A child might have seen a quarrel between mother and father, very in a bad condition. All these things will be built up in the child. Therefore, try to see child to express their emotions and be consistent. Warm body language, especially, builds a foundation for trust. That means a smile when the child makes a mistake. Don't grudge and don't complain and don't tell you shut up and sit down. Try to be very simple body language telling please sit down, smile. And that is a very helpful thing. Teachers at the primary level should be able to identify their needs. They should monitor sudden changes in behavior or social withdrawal. There are instances when you have seen a child stands up, he or she will not be able to answer anything, child looks left, right, all these things. Maybe fear of the teacher or fear of some other students might be there. Therefore, try to see how you can help the child. Looks for physical signs of stress, fatigue, or frequent body aches may be there for children. While playing, they might have hurt their body, their legs or fingers or whatever it is. So they will not express, but look at their face and find it out. Early identification allows for quicker support and better outcomes. So when we can identify some of these very simple fatigue signs and the standing without talking, fear signs in the face, facial change, when such changes are seen in the body of the child, try to identify such children, help them out, document them, the pattern that happens. If a child consistently shows fear, write down in your diary what kind of things they do, and maybe pattern may help you. Classroom support strategies. Create a calm down corner. We have done that in our school. A small place, maybe a last bench or a small table and a chair where children can, we call it calm down corner or quiet corner, where a child can sit down. You can send a child, if you find he is stressful, make them to sit down for a few minutes, tell them to close their eyes and deep breathe and pray God, and then self-regulate their emotions. Use daily mood checks to help children name and process their feelings. Tell children, how many of you have fear today to learn mathematics? I have tried this. At least about out of 40, 35 children would raise their hands to tell they have fear of learning mathematics or arithmetic. Such things should be done so that you understand what kind of complex feelings children have. Try to take restorative circles to solve peer conflicts through open dialogue. Talk to them, help them to not to quarrel with each other. Celebrate effort and kindness to build positive classroom culture. Maybe if a child does a good job, write their name and tell them to give 3 claps. Such things will help children to elevate their mood. What are professional boundaries? That means, as a primary school teacher with limited knowledge of counseling and helping children, what is that you can do? Recognize that a teacher's role is to support, not to provide any clinical therapy, not to give any treatment. You only support the children to learn and to calm down their stress and anxiety and fear. Collaborate with parents, especially if you find a child consistently having fear of something. Talk to a specialist nearby and then try to help the child. Always follow rules and guidelines. Do not abuse children, do not hit children, and do not say make them to go to the classroom. Know when to refer a student to some specialist or a better teacher who can and take care, take the help of expert if required. Credits, content, design and narration by me. When I had been to recently a few schools, which I do not want to name, primary schools, I discovered that many children were having stress and fear, and when I asked the teacher why it is so, they explained to me a few things. So based upon such feedbacks, I just made this particular presentation for YouTube. I took support of Gemini and YouTube. Thank you.